Okay, guys, we're back with another test question, another practice question for you. This one is on medication errors. Very, very important topic for your nursing school and for your NCLEX studies. Medication errors are very serious occurrences. There are different types, but this is the um, uh, fundamental type question on medication errors. So let's get started. A patient receives the wrong medication. The nurse who made the medication error should do which of the following actions first? So there's a few words in the stem of the question that are clues. Okay, which of the following actions first? So this is what? This is a priority question, another priority question. To keep the patient safe, to assess you on your ability to identify the priority in the situation. Okay, and so if you know the nursing process, very important. The nursing process has 5 steps: assessment, diagnosis, planning, implementation, and evaluation. Okay, and so what's the first step of the nursing process? When you're answering these questions, you should be thinking about priorities, ABCs, airway, breathing, circulation, safety, Maslow's hierarchy of needs, and also the nursing process. So the nurse in just about any situation, I never say always, I never say never, but when you're answering these test questions, if you see an answer choice that says that the nurse should conduct some type of assessment, take a close look at that answer choice. I'm just telling you, I've seen enough of these questions, and I've given enough of these questions, that if there's an assessment that the nurse should be doing, take another look at that answer choice. Okay, so let's read through the answer choices. Call the client's provider. Number 2, assess the client. Number 3, notify the nurse manager. Number 4, complete an incident report. Okay, key word is which of the following actions should the nurse conduct first? Okay, some of them may be correct. These are NCLEX style questions. Some of them or all of them may be correct answers, but which one is the priority? And that's what you were trying to identify in this question. Okay, so let's give you a second to look over these answer choices and think about what you think might be the answer on this one. Let me take this opportunity to encourage you, if you're getting something out of this content, encourage you to like, share, and subscribe to my YouTube channel, which is Nursing with Hart, PhD. Okay, let's go back to this test question. So the patient has received a wrong medication. That's a very serious medication error. What's the priority that the nurse should do first? What would the nurse do first? And the correct answer is, from the clues I gave you, you should have figured it out. Number 2, assess the client. That is always the first thing you're going to do with a medication error. Okay? The first action the nurse should take using the nursing process is to assess the client. The nurse must first determine whether or not the error has caused the client any harm, and also provide any relevant nursing interventions that are going to be needed for the patient who has received the wrong medication. Depending on what medication it is, depending on the patient's history, they may have an allergy to that medication they were just given. You have to go quickly and assess your client as soon as you realize that your client has received the wrong medication. Okay, so let's go over these other answer choices. Number 1, call the client's provider. That's what you would do after you assess your patient. You would call the nurse client's provider. You have to notify them in case the client needs a medical intervention and to follow the facility's protocol for such incidences. However, there's another action that's more of a priority that the nurse should take first, and that's to assess the client. Number 3, notify the nurse manager. Again, yes, you're going to notify your nurse manager following your facility protocol. However, to assess your client is the priority action. And number 4, complete an incident report. Again, yes, you are going to complete an incident report. The nurse will have to complete this incident report following facility protocol for such incidences and to give risk managers the opportunity to investigate and institute preventive measures if necessary. But there is another action that is more important and takes priority, okay, and that's to assess your client. All right, and that's it for this one, and we'll see you on the next test question. I'm also going to cover some more content on mental health. I didn't cover schizophrenia yet. I didn't cover all the substance use disorders. There's quite a few. I only cover the most common substance use disorders generally because in the 2-hour two credit class that I was teaching on mental health, there just wasn't enough time to cover every substance use, such as caffeine or THC. Those are important, but the priority I felt were the substance uses were the following: alcohol, opiates, stimulants, okay, benzodiazepines, alcohol, cocaine is another important one. I've seen that on the standardized test, questions about cocaine. I cover the stimulants, ADHD medications, ones like that. So those are the ones I cover, and I'm going to do that very soon, so look out for that one also. The reason I cover those topics more than the others is because those are the substance use disorders that are more common in our country, especially alcohol use disorder, very common in our country, and also opiate use disorder, stimulants. Okay, so look out for that, and we'll see you on the next one. Have a great day.